size, the muscles pumping normally, and the amount of blood that's being pumped out of the heart with each beat is normal. So that looks great. Now on the stress test, the nuclear MPI, we look at a couple things. What we're looking for is something called ischemia, and that is basically our fancy name for saying a lack of blood flow. In this case, we're looking for a lack of blood flow to the heart, so that would be called cardiac ischemia. So on this stress test, we look at two areas. We look at the pictures, the images we did with the nuclear study, and then we also look at your EKG, the electrical rhythm of your heart. So if we see an abnormal on one but not the other, a lot of times that means we need to do additional testing. So on the imaging looked a little bit questionable for an issue with blood flow. However, the EKG portion, the electrical portion, looks pretty normal, which is good news. So we would consider this an intermediate risk stress test, as an intermediate risk for a cardiac event. Not a high risk, which is good, but as it is still abnormal, he wants to do another test. It's a more thorough test, and a lot of times people have to have an abnormal nuclear stress test for insurance to be willing to cover this more accurate test. It's called a coronary CTA. That gets a really, really good picture of the heart, and it can help us locate if there are any blockages or areas that are close to being blocked. We get an excellent picture of that. If you're agreeable to doing that, just so we can get a little bit better view, additionally, it looks like you did have a little bit of tissue artifact on there. So especially us women with our breast tissue, sometimes that can give us a not great picture as well. So that also is a factor that we're taking into account. Is this truly an accurate intermediate risk stress test? And the coronary CTA will help us, quantify that and make sure. But if you're agreeable to doing the additional testing, I can have schedule and give you a phone call. It'll probably be Monday since tomorrow is a holiday.
Okay. All right.
Now, this particular test, we like to see your heart rate a little on the lower side. So what we do is we give you a medicine to take an hour and a half before your test time, and it's called metoprolol. It helps slow your heart rate down just a little bit. You should still be able to drive, no issues there. But just remember that you'll be needing to take it an hour and a half before the time that imaging gives you. And I will put that on the bottle when I send it to your pharmacy too.